Joining us today for our last discussion, Breaking the Stigma about Mental Health, are Shantae Dawes. Ms. Shantae Dawes, who will be the moderator. Ms. Dawes is an accomplished entertainment industry veteran, speaker, author, and philanthropist. The nonprofit foundation that she founded, Silence the Shame Incorporated, has led the way in mental health movement since 2016. Next, we have Dr. Sarah Y. Vinson, I think I'm saying it right, Vinson, sorry about that, who is a triple board certified child and adolescent, adult, and forensic psychiatrist. Dr. Vinson is a national thought leader regarding the intersections of social justice, criminal justice, and mental health. Also with us is psychiatrist, life coach, and CEO of Healing for All, Dr. Sherri Broadwater. She currently serves as the Women's Health Section Chairman for the National Medical Association. Psychotherapist and certified clinical trauma professional Dr. Sharnell Myles is also joining us. Dr. Myles' dedication to serving children, youth, and adults has spanned over 23 years with a focus on utilizing trauma-informed services to treat issues such as sexual abuse, domestic minor sex trafficking, and community-based trauma. Rounding out the panel is my girl, Dr. Contessa Metcalfe. As the owner of Chastain Integrative Medicine in Atlanta, she specializes in preventive, occupational, and addiction medicine. She is also co-owner of Hot Doc Nutraceuticals, I think I'm saying that right, supplier of high-quality vitamins and supplements. You may also recognize her as one of the leading cast members of the reality show Married to Medicine. Let's all acknowledge and welcome these amazing people and advocates who are passionate about improving our mental and emotional well-being.
Thank you so much, Cynthia. How y'all doing today? Okay, come on. I know y'all done seen a lot of panels. How y'all doing today? And I need another big round of applause because these women are saving lives up here. So we want to honor them and thank them for everything they're doing. Thank you again to Black Health Matters. Again, my name is Shantae Dawes. I'm your moderator for today. I want to read a little blurb before we get going. So there are so many reasons why we may be overwhelmed, stressed, or just having a tough time coping these days. Every time we turn on the news or scroll through social media, there's a tragedy, numerous stressors all around us, from mass shootings and senseless gun violence to natural disasters, stressful elections, and so much more. And add in our normal work-life stress, the loss of loved ones, caring for our parents, raising our children, it can all sometimes feel like we're just on a hamster wheel, right? And we can't get off. So this is an important time to recognize and honor our feelings and have safe and healthy ways to cope with our mental health challenges, which I think we all recognize after the pandemic, right? That we all have mental health. We may not all have a mental illness. And just a note of housekeeping, I would like to issue a trigger warning. If anyone feels that any of the information shared today makes you feel uncomfortable, please feel free to step away, step outside, honor your feelings, and recenter yourself before you come back into the room. All right? So ladies, let's get started. I first like to kick it over to Dr. Broadwater to educate us on what is mental illness. And she has a couple of slides that she'd like to share.
Good afternoon, everyone. So what is being mentally healthy? Does everybody know what being mentally healthy is? It really is about 7 different things, okay? And just like Shanti said, that just because we don't have a mental illness, that doesn't mean that we necessarily that doesn't mean that we are mentally well. Okay, first thing is, it's being realistic. It's being flexible. It is having a positive identity. It also means having a positive collective identity. It means that we have a variety of relationships that are nourishing and fulfilling. It also means that we have a variety of activities that are stimulating. That means we also are aware of our self-care tools. That means what is self-care? It is all and everything that is needed for being mentally well. that is coping strategies, it is healthy body habits. It also means that we have problem-solving skills and that we are also able to ask for help, that we are able to manage, deal, process, understand our thoughts, feelings, and reactions.
Okay, so we're going to jump right into the questions, and I'm sure some of the questions will be brought up in terms of what we're going to discuss today for the questions that I put together. All right, so my first question, and we'll go back to you and we'll go to Dr. Myles. How is a mental health disorder defined, and what are some of the signs and symptoms of anxiety, depression, and bipolar disorder?
Okay. So mental health, you all heard Dr. Broadwater describe what is mental health. And so when we really look at it, oftentimes we are assessing someone to see if they do have an identified disorder based on impairment in any area of their life. And so for me, specifically at Embark, we work with children, adolescents, young adults who typically come to us because they think that there's maybe some depression, anxiety, suicidal behaviors, or self-harm. And so we complete what we call a biopsychosocial or other assessment tools to ask, okay, if you're in school, are you experiencing different impairments or levels of impairment? And that could be anything from like skipping school to not engaging in school, suddenly grades decreasing, just a number of things. We look at community, what's going on and how are you functioning and interacting in your community? Even at home, has your behavior changed? Are you withdrawing from your family? Are you feeling sad most of the time? Or is there tearfulness? Are you eating more? Are you eating less? And so there's a lot of questions that we ask based on several areas of your life to see what the level of impairment is.
Thank you. Great information. I recall, I was in the music industry for many years, and I ended up walking away from my job, and a lot of those signs that you mentioned, I was withdrawing from family. I didn't want to get up in the morning. I just didn't feel like myself, and I didn't feel worthy to be living anymore. And so luckily I got the help that I needed. But thank you, Dr. Myles, for sharing that. Dr. Broadwater, did you want to add anything to that? Because there's some other disorders like schizoaffective disorder, schizophrenia, some of the more severe mental illnesses that we really just still don't know a lot about in our community.
So let me say this first, that one thing that often comes up is depression and sadness. I'll just say that all the psychiatric disorders are not just one symptom, okay? It's more than one symptom. So just like Dr. Myles said, so even for clinical depression, it is sad mood or disinterest plus 4 symptoms that occur over a specified amount of time. And for clinical depression, it's only 2 weeks. And there is disruption or distress in your life. So that is the distinction that we have to make, because people say, well, I'm depressed and I'm sad and it's not a big deal. We're talking about multiple symptoms that are occurring over time that are distressful to our lives. And so it's in terms of schizophrenia, so when we think about schizophrenia, it is more than just psychosis or hallucinations. It's one of the two, but again, it is a disruption of our lives over time. And it's usually a 6 months decline in functioning before the actual diagnosis of schizophrenia even occurs. So that distinction has to be made. So you have the development of some symptoms that the person is displaying that make them not be aware of their surroundings in some way. And there is social decline, intellectual decline, functional decline if they're working or they are going to school. Okay, and that is also very rare. Schizophrenia is very, very rare, and so that's just important, because sometimes we just sort of overly, you schizophrenic, or you seem bipolar. These are diagnoses. Really, we need to be very careful about the language that we use. And the bipolar disorder is between like 9 and 12% of the population, and schizophrenia still is about 1% of the population.
Thank you for that. And I love the fact that you said be careful with the language you use, right? Oftentimes we'll see someone in the community or in our family, we'll go, oh, that's Johnny, he's bipolar. No, Johnny's not bipolar. That's Johnny. and he happens to have bipolar disorder. We are not our diseases and our disorders, right? So that's very important that we do that. Okay, I'd like to go to you, Dr. Vinson, next. It's been said that mental health disorders such as depression, anxiety, and certainly more severe disorders like we just talked about, bipolar disorder, schizophrenia, et cetera, are a silent crisis. When we have a physical illness or condition, we don't typically have a problem with going to a medical doctor to alleviate it, right? To get the help. You break an ankle, you go see, someone. You have cancer, unfortunately, you're going to see your oncologist. Although more people are opening up these days, I really feel like stigma is still so prevalent in the Black community around mental health. How can we silence the shame around mental health and encourage those in our community to seek professional help from people like yourself?
Well, thank you for that question. And it is one of the areas where we're certainly learning more. And I think people like you being so honest about your experience and how seeking help has helped you is huge. And that's, to me, more meaningful than, us saying it, because we're part of the field. And so I think that continued dialogue from people who have received that help and seen it change their lives is really important. Part of the challenge, I think, when it comes to seeking mental health help is that with mental illness, the brain, the organ that helps you make decisions, is the impacted organ, right? So it's harder to see it and recognize it and comprehend it in the same way. And the reality is too that the same stigma that impacts mental health when we think about it impacts mental health care in the healthcare system. And so I also always want to pair acknowledgement of stigma with acknowledgement of the fact that sometimes it's hard to find the help that you need, especially if you want people who understand what it means to be a Black person in society dealing with mental health issues.
Absolutely. Great information. Yeah, you guys can give it up for that. Dr. Metcalfe, can you tell us a little bit about your practice and what are you doing to help alleviate stigma in the ways that you are helping to heal our community from a holistic perspective?
Absolutely. At Chastain Integrative Medicine, one thing that I do is I actually treat substance use disorder, and kind of going back to understanding about the Black community in particular, right? If you think about the whole crack epidemic and how it's, how it was viewed in contrast to the opioid epidemic. And one of the big issues about the approach, right, about the crisis is the look of the people who are suffering. And so when you think about the penalization and the criminalization of Black people as a result of having substance use disorder, which is typically the result of untreated trauma and untreated mental illness, right? And you look at these books, Up from Slavery, right? The Souls of Black Folk. These books are still very relevant today because the impact of that trauma that we experience as a result of slavery, and that we're still experiencing these microaggressions, and essentially not understanding that just because something is common it's not normal. Meaning, there's a thing called adverse childhood experiences. And if you've never taken the test to see if you yourself has been exposed to adverse childhood experiences, examples. Before the age of 18, did you ever see your parent being slapped, hit, punched, kicked? Did you have a parent who suffered from substance abuse or mental illness? Did you have a parent that was incarcerated? Did you have a parent who are parental discord, right? Your parents were separated, constantly fought. All these things increase your risk for mental illness, depression, anxiety, things like that, and PTSD. And also, if you are thinking that this is not something that warrants treatment because it's, again, common, so you don't even realize that it's trauma, and it should not be something that you just have to endure and treat on your own. You won't even think to get treatment because it's just normal. And that's the difference, I think, between our community and a lot of other communities, and why that stigma does happen. So in my clinic, what we talk about is some of these, I meet people where they are, right? So a lot of people don't quite feel comfortable maybe being on medication, but we do talk about diet. We talk about exercise. We talk about talk therapy. We talk about possibly, just talking to someone. And we don't have to necessarily label everything. And I'm not real, I try to meet people where they are, because people don't like to be told that they have depression or they are anxious, because anxiety, constant worry about regular situations in life is very common. But you think because this is just who you've always been, and this is what your mama did and your daddy did, and this is what my sisters do, you don't even understand that you don't have to endure it, and there's treatment and help and therapy for you. So
Yes,
that's what we do at our
absolutely.
clinic.
Yes, thank you, Dr. Metcalfe. Okay, y'all turn to your neighbor and say, neighbor, it's okay to talk about it. And that's what we're doing today. We're going to keep normalizing this conversation. Great information, Dr. Metcalfe. Now, one of the things as a community advocate and the work that I do at Silence the Shame, we're talking to people, parents, caregivers, grandparents, and we have seen the recent rise of suicidal ideation, suicides amongst our teens, depression, anxiety. So many of my friends and peers have kids that are in college, and they are really going through it and experiencing, I think, mental health challenges in ways that at least haven't been discussed, right, and talked about. So what advice would you all have for parents who feel that their teens or child may be experiencing a mental health challenge? I'd like to start first with you, Dr. Vinson, with the work that you do from a pediatric perspective.
Thank you for that. And I'll say these past few years have been challenging for all of us. And that is as grown people who've already had the opportunity to go through life and develop coping skills and get your feet underneath you in society, right? Think about trying to enter into adulthood or figure out who you are or make sense of the world in the context that we've had the past few years, right? So it's not a surprise that our young people are having a hard time. One of the things that sounds really simple, but actually really matters is just spending time with people and being present. I do a lot of traveling, and so I see families together in airports, and a lot of times I'm traveling on my own, and I'm a shrink, so right, I watch what people do. And I see so many times where it's not just the kids on the phone, it's the parents on the phone too, right? These are opportunities where people could really be present, be interacting in a meaningful way, and it's missed. And so one of the things that you can do that is within everybody's control is to give that child your full attention when you have it. Because if you don't know their baseline, if you don't understand how they are when they're doing fine, it's going to be harder to understand or to notice or to recognize when things start to go off course. And a lot of times what happens when our families are stressed, when our communities are stressed, is the symptoms have to get really extreme before anybody notices.
Thank you. Dr. Myles, would you like to add anything to that?
Yes, and thank you for that question, because I immediately thought of my son who's sitting over there, and I know he's going to have something to say about this when we leave. But just Monday, we were sitting at home, and I heard him scream, and I'm like, Jordan, is the house on fire? Like, why are you screaming like that? And he ran downstairs and he showed me his phone. One of his really good friends had written a goodbye letter, and she sent that out to every student in the 11th grade. And I immediately called her mom. I called the head of the school and said, you need to go in her room now, check on her, and get her to help. And so I'm going to make this blanket statement because it's necessary. Our children are struggling. They are struggling. During the pandemic, when many providers had to close their door because of financial impact, we were actually opening clinics because the need was there. Most of the kids who came into our clinic pretty early on came because they had just been released from the hospital for suicide attempts. And there, when you talk to the kids, and I'm so happy you said just spending time, because we have to listen to our kids. And this is why we have to do away with stigma, right? Because there's a stigma around even saying, hey son, hey daughter, how are you doing today? Every day when I get in the car, my son asks one question, hey mom, how was work? He learned that on his own, right? I'm sure I had something to do with it. Thank you, son. But that is his first question to me. And I immediately follow it up with, hey son, how's school? So just checking in with our kids. There are still kids who are dealing with feelings of isolation, depression, bullying. You name it, they are dealing with it. And so we have to ask these critical questions. We have to stop saying, boy, girl, what's wrong with you? Ask what has happened to you and really get in there and understand the impact of social media, the impact of dealing with other kids in school. We cannot forget what happens with our parents? My work for so many years have really, the approach has been a two-gen approach, at least a two-generational approach, because we can't treat our kids in silo. Our parents are struggling as well too, right? And so we have homes where mom and dad are depressed, or it's a single home. There may be domestic violence, parent laid off from work, and the children are soaking it in. They're soaking it in. And so we have to stop being afraid to ask these critical questions, to spend time with our children, and stop being afraid to reach out to somebody if your son or daughter is struggling.
That's right.
Even if it's a neighbor. I say we need more Miss Pearls. Everybody, if you ever watched 227, you knew what Miss Pearl was doing all day, right? We need more Miss Pearls back in our communities.
Yeah,
So,
we need the village from a mental health
Yes,
perspective. 100%.
absolutely.
Great information, and we need to lead more from a place of empathy and not sympathy. Don't feel sorry for me because I'm depressed or I'm experiencing trauma, but you can also try to be a little bit more empathetic, right, and support us. Dr. Broadwater, did you want to add something to
I
that?
just wanted to add, because I'm in private practice in the Atlanta area, and I'm one of the only Black women psychiatrists in private practice within 285 who accept insurance. So our practice saw a lot of Black families during COVID and after COVID. And one of the things, I'm going to tag in the village. So many of us don't have a village. We don't have a village, and especially, and let me say this, my transplants to Atlanta, we underestimate what it requires to create community, and we haven't created community. Many of us as African American women, because of the strong Black woman eco model, we were already very stressed before COVID. COVID pushed us over, and then we were just isolated, overwhelmed, and just didn't have what we needed. So one thing in terms of going back to being mentally healthy is that creating a practice of, I'm going through these 8 criteria every day for myself. Have I checked in with friends? Have I connected with the people that I need to connect with? Have I managed my thoughts and feelings and responses appropriately? Do I have a positive ideal? Have I been realistic? Have I been flexible? Do I have a positive ideal? Every day I run that script, and I'm a psychiatrist. And then we teach our children every day to run the script, to ask the questions of themselves, and even in the village, so that it's not just your solo child or just you. It's all of us talking about it consistently. So we've got to do some work, but we can get there.
Absolutely. Amen. One of the things I do a lot of panels, and I speak around the world. And when I'm sharing my story, I tell people I coined this new acronym for RAP, right? Because I came from the hip hop industry, but you can write this down. So rapping through your mental health challenges, right? The R is being able to recognize those unfamiliar thoughts and feelings that you may be experiencing. The A in RAP is you got to acknowledge it. How many times has something happened and we act like it didn't happen? We're like, oh, I didn't do that. That wasn't me. You got to acknowledge it, and then you have to accept it, right? Another form of the A, accept those feelings. And then the last thing is the P is processing through them with a professional like the doctors on these stage today. So you can rap through your problems in a healthy and positive way. And the last thing, talking about the village, is I ask people, who's in your starting 5, right? We're in the middle of basketball season, NBA All-Stars next week. Those teams can't get on the court until they have 5 players. Who are the 5 people in your life that you can call if you're having a problem? If you're a transient or transplant to Atlanta, you need an Auntie Shanti like me in the room. I don't have kids, but I got a lot of kids in the community, right? Yeah. You need Big Mama. We need to get back to those days as a community that we support each other from an emotional health and wellness perspective. We got to do this together. Right?
Absolutely. Yep.
All right, this next question, thank you.
Yes.
I'm really excited about as a Black woman, and I think so many of us are dealing with this. So many Black women face depression and anxiety, but we don't often talk about postpartum depression, right, as Black women, or depression due to menopause. Lord, I am in the middle.
Yes.
I take my fan everywhere I go, but the ups and downs and all around is real. So how do we best address mental health challenges, and what does that look like from an integrative approach with our medical doctors and our therapists? Who would like to start with that?
Well, yeah, it's really all about, that's the point. First and foremost, I remember when I was little and I would cry. My mom would be like, I'm gonna give you something to cry about. But I'm crying, so clearly what I'm crying. So we have to stop addressing our lives in that way, that we minimize our pain. And that being something that Black women do in particular. We are taught to suppress what we go through. We are taught to just get over it, get past it, get through it. But we don't go and get help for those things because it's something that honestly we are passing, we're modeling to our children. And one of the things that we also didn't talk about is perimenopause, which happens 10 years before your period actually stops, and all those hormonal changes that are going on. And so again, prioritizing yourself, going to see your doctor, getting, there's treatment. If we can't highlight anything enough, today, you just need to know that what you're going through, there is treatment. We think that we just have to just suffer in silence the shame, don't talk about it, because for some reason there's magical thinking in our community in particular that not talking about things makes them go away. It actually makes it not only fester and grow, but one thing that's worked for me is understanding I have 3 little people who are watching me. And so I think me doing this kind of dance of not addressing things and not talking about things and even not processing things, one thing that that you're doing is you're teaching your children how to operate. And I have 2 daughters. And so when I, as a woman, will have some episode that I just was crying or I was upset about something or there was some discussion or fight that I never addressed again, they're taught to do exactly the same thing. And that's what I've been trying myself, just to be really, really clear and honest. And I talk to my patients. I talk to them. I ask them those hard questions. We talk about not only just what are your, are you having problems sleeping, eating, your interest in activities? Are you connecting with people? Are you having sex? Are you in a healthy relationship? Are you having, in your relationship, are you often taught that you are unimportant, that you don't matter, that you're stupid? Are you called names? I ask these hard questions because unfortunately, if you think again, because it's common, that it's normal, then you really won't even bring it up to me. So I just try to just address it head on. And that actually normally opens the door and then we can move forward.
Thank you. Would you like to add?
Can I add to that? And I'm just going to rewind it just a little because advocacy is so important. Advocacy, especially in our community. My last child, I had at 27 weeks. And as educated as I am, I did not have someone to advocate for me when I could not speak, right? I saw the same thing in the young ladies who I've worked with who are survivors of sex trafficking and who may have become impregnated by a buyer or someone else. And they would go to their doctor for prenatal checkups and the doctor, okay, get up on the table, spread them. And the young ladies would freak out and never return. And so I started working with physicians to create trauma-informed birthing plans for these young ladies because they were not asking the questions about trauma or do you have someone to advocate for you? If they probably would have asked, they would have known that they had been involved in sex trafficking and understood the trauma that comes along with that. And the young ladies may have continued with prenatal care. And so, a lot of us are in a place where we can advocate for other people. Like you said, who's in your corner? Who's your starting 5? Pick someone, take them with you to the hospital. Whether you are going through menopause, maybe you need someone to advocate for you there. Or pregnant, just a number of issues. So definitely advocacy and just being able to have someone speak for you.
Yes, that's so important because to your point, we don't have, I remember being in the hospital last year, not around mental health challenges, but having to advocate, I was there by myself, right? And I was getting ignored and it was really frustrating. And that leads to stress, which can lead to depression and so many other things. I do want to honor the people that are watching online. So y'all wave to the people who are watching online. If you are watching, I'm going to reset the room. You're tuned into Black Health Matters panel, Breaking the Stigma. And some really great information being shared today. I want to move to something that I think is really, that has been plaguing our community for many years, trauma. Right. And so you think about trauma from 400 years ago with slavery, there was a term called drapetomania, right? So if slaves were trying to break free and the master caught them, and when they brought them back to the plantation or what have you, they told them they had a mental illness called drapetomania just because they wanted freedom, right? So it was never really on our side to seek therapy and seek support. So my question today is, Mental health challenges have been a fabric of our community since the days of slavery, as I just mentioned, especially when you think of the trauma that we as Black people have faced over the years. How do we address trauma head on, and what are the different types of trauma therapies and treatments to support this condition for our youth and our Black adults? And we could go on and on. It could be a whole panel just around trauma and police brutality and the things that we face from a systemic racist perspective. But I'd like to start with you first, Dr. Broadwater.
Well, I think like we've said, first of all, recognizing what trauma is, and Dr. Metcalfe went down a litany of examples, and just knowing that with those types of events that are overwhelming and maybe threatening, and where our lives were threatened or other lives were threatened, that there is impact. There is a physiological impact, there's a psychological impact, there's a social impact to those occurrences. And if we're not aware, those things then can then cause symptoms and signs. Symptoms are the things that you experience, and the signs are the things that other people experience in us. And this goes back to the village. Having that group of five that, whereas you may not know that there's been a change, but because I have Valdacia, who knows me, she can say, Sherri, the last few times I've talked with you, your thinking wasn't as clear. Or you've asked me the same things over and over again. Or my husband may say, sweetheart, I've noticed that you're not sleeping. And so we need the self-awareness, but we also need those other people in our lives who can bring those things to our awareness, so then we can address it. And it is so important that when we're thinking about a physician or a therapist or a psychologist, it may take a few times before it's the right fit. Because sometimes we just go down the Psychology Today list or whatever the list is, and we just make the call, and let's say we go to the doctor and it doesn't fit, it doesn't feel good, and then we give up. It may take, and I invite patients to try me out. Come, let's see what you think. I may not be the fit. So, but if I'm not the fit, I'm gonna try to get myself out the way so that you get connected with the right person. And then also in terms of health, that it is important to find a doctor, find a physician, clinician that you trust. If you do not trust your doctor, your physician, your clinician, that is not the person for you. You gotta keep going.
Yes, thank you, Dr. Broadwater.
Yeah.
I will say also from a trauma perspective, y'all stop looking at these videos of Black and brown kids getting killed and men. You don't realize how you are re-traumatizing yourself. I cannot stress that enough. Would anyone like to speak to that quickly? Just watching the social media videos and how we can re-traumatize ourselves?
Well, you said it. I mean, it's something that, again, has roots in our society, right? So our foundation as a country really depended on the dehumanization of Black people, right? And violence perpetrated against them to keep them in their place, right? And years ago, they would send postcards with pictures of people who'd been lynched, right? And I really see some of what's happening today as the current manifestation of that same thing. You know what you're up against. You know what your sons are up against. You don't have to expose yourself to graphic images of people who could be your son, your brother, your husband being harmed by people in state actor uniforms. Don't do it. You don't need to.
And I'll add, we say trauma, but trauma is so widespread. Even when we look at it from a psychological, emotional standpoint, you can experience one single trauma, never have any symptoms, where someone else can experience a single trauma and have symptoms. There are a lot of people, even in our community, who have complex trauma, right? And so, it's not just affecting the way you sleep, how you're thinking, but when you start having those heart palpitations or stomach aches or just a number of physical symptoms, that can also be the impact of trauma. I'm happy you said, stop going or not believing that treatment does not work. It works. trauma treatment or trauma responsive treatment works. There are many approaches that we use. There are also cultural based approaches that we use to treat trauma within our own community. So like Dr. Broadwater said, get with a therapist that you trust. Maybe it's someone that looks like you, maybe it's someone who doesn't look like you, but try it, and try it a third time or a fifth time if the person's second time doesn't work, because it does work.
Absolutely. I tell people, therapy is kind of like dating. You keep on swiping until you find the right one. Don't give up on it. We only have about 5 minutes left, if that's okay. I just want to kind of go around, and if you ladies can definitely tell us what are some ways we can strengthen our mental well-being in our communities, our schools, our faith communities, and any resources. So we'll start with you, Dr. Metcalfe.
Well, I was going to say there are two things that I would like to highlight, especially things that I see in my practice. Number one, when a family member or your child or your sibling or loved one says they want to get therapy, stop taking it personally like it's something that you are failing for them. Like, why couldn't you talk to me about it? Because you're not a trained clinical psychotherapist. And honestly, the other thing that people don't want to do is get re-traumatized by you reminding them of what they went through in their pain. So it's always best to outsource that. The true act of love is to get them help, but you don't need to be the one who takes all of that on, because you probably don't know what to do with it anyway. What would you do if someone told you that I am working on a plan to kill myself? That's too much for you to try to handle. And so honestly, an act of love is to get them help. Call 988. Number two, when it comes to thinking about kids, right? You have to think about also when kids say things like my stomach hurts, or they don't feel good, or they're emotional. Those are symptoms. Kids are very different than adults. They're symptoms sometimes of the trauma and pain that they're going through, and their symptoms is anxiety, because anxiety typically starts around age 10, 11. And that's actually way more common, that constant worry about daily activities. Those kids have symptoms like that. They just sleep too much, right? And you call them lazy or demotivated. Those are signs that they need to probably get some professional help. And so I know we do this in our community, but we got to stop insulting our children, because it doesn't feel good. When someone calls me lazy, it hurts my feelings. And so watch your words, especially when you're dealing with your friends and your kids and your loved ones, because if what you were saying to them would be something you wouldn't want to personally feel or hear, then understand it's received in exactly the same way.
Yes, thank you. Dr. Myles, what can we do to strengthen our communities, our faith communities, our schools, what have you?
Yeah, build community. Build community. Know who your trusted individuals are, your tribe. Create a self-care plan. So there are 8 areas that I help people create a self-care plan: financial, spiritual, physical, psychological, and a few others. It is a living, breathing document. It is not a document or a plan that's perfect, but create a self-care plan. When you get up in the morning, I have a friend, Anana Harris-Paris, she talks about self-care being revolutionary. And so make a plan. It doesn't have to be huge, big steps. Even a tiny baby step can help you through the day, but have it written out. I have one that's on my bathroom mirror, very convenient where I can see it. And so, but get you an accountability partner. If you know that you suffer with mental health issues, get you an accountability partner, so when they see you just having a little bit of trouble, they can reach out and say, hey, use your self-care plan, or what can I do for you today? What do you need at this very moment to help you get to the next moment?
Thank you. Great tips that I'll start implementing into my self-care regimen. Dr. Broadwater.
Okay, so just really quickly, just back to the medical part. In terms of the psychiatric medications, the medications need us to be eating healthy. Okay, so the medication, like for an antidepressant, a main group is SSRI, the medications help the nerve cells access the serotonin that's in your body. But you've got to be eating healthy. So if you're not eating the right amounts of tryptophan, if you're not exercising, if you're not getting enough of the nutrients in order for the body to create serotonin, it doesn't matter about the medications. So this is why the healthy eating is just as important. So and we can't out-medicate a poor diet. We can't out-medicate a lack of exercise. Oftentimes when we are not hydrated, what happens? We feel so sluggish, we feel tired, we're just, and if we're not careful, we can then think that we're depressed. So all those things are needed. We need vitamin D. I know that often we're not as many African Americans are not as outdoorsy as other folks, but we need those things as well. So healthy eating, exercise, hydration, and being outside are critical to us being mentally healthy.
Great advice. Thank you. Dr. Vinson.
So I would say for my two things, one is this idea of a mental health continuum, right? So a lot of times the conversation is you're crazy or you're not. You're sick or you're not. You have a diagnosis or you don't. And that's really not how people are. We're all on a continuum between mental illness and mental health. And all of us at any time in our lives can be pushed one direction on that continuum or another. So what I welcome you to think about is, where am I on that continuum now? What in my life pushes me more toward health? What in my life pushes me more toward illness? And be conscientious and unapologetic about changing that ratio, okay? And the second thing that I would say, and it piggybacks on something that was alluded to earlier, in our society, caring for yourself with skin that looks like yours is an act of political warfare, to borrow the words of Audre Lorde. That's all you got to do to help your community, is take care of yourself.
I love that. Yeah, you can clap for that. And I'll just add, my organization, Silence to Shame, we are local to Atlanta, but we do national work. You can visit us at silencetoshame.com. We're having an upcoming event on February 21st at Ebenezer. We do self-care social. So get active, right? Find your community, find people to help support you, and set boundaries. It's okay not to take that phone call after 5 o'clock. I set boundaries for myself now, and I'm so proud of them, right? Because I don't allow myself to be stressed out, because if it wasn't solved, we can deal with it in the morning, right? If it's not life or death. And I lost my sister unexpectedly 4 years ago, just lost my mother. We don't talk enough about grief and how it affects our emotional health and wellness. So give yourselves grace when you deal with these sort of situations. And that's one thing that I would say for our communities. We have to bestow grace upon one another, whether it is in the workplace, in school, in our faith communities, as we all try to live our best life. We're gonna have to wrap up. Now, do we have time for Q&A, or are we done? Okay, we're going to do 2 questions from the audience. This young lady right here and right back here. All right, so our first question. There's a mic over on that side. You want to just take this one mic, sister? Tell us your name and your question.
My name is Eugenia Bowie. I am a fellow brand ambassador with my assistant, Cynthia Bailey. And then I'm an author of Get Your Life. And the book is purpose for exactly what you're talking about. I am not a mental health coach or a psychiatrist or a therapist, but I am someone with a story and with a testimony. And I think it's very important and healing to have conversations that we don't normally have in the Black community, especially with Black men, right? I don't see a lot of Black male therapists. I have a few men in our family who are looking for Black therapists, and they seem to be like non-existent, right? So I was wondering what we can do about that, but I was also going to say that sometimes we have layers of trauma that we don't deal with. Trauma being with some of the things that happened to us when we were younger. Trauma being with some of the things that we happened, and with racism, and also trauma being with some of the things that we deal with our health. And because we don't deal with that, because we're taught to handle it, like we said, as Black women, just put the H on our chest and then handle it, we never know when it's okay to have the conversation.
Right.
So I appreciate the conversation being had, and I'm hoping that we can open the door even more to deal with the Black men and the Black young men who are also dealing with the trauma as well.
Thank you for your question. I'll just say briefly, if you go to therapyforblackmen.org, there's some incredible organizations out there. Also, shout out to Black Men Heal. I know a couple Black therapists in Atlanta, male therapists that are fantastic. You want to say anything to that about Black male therapists, Dr. Myles?
I was just going to say, speak to me. There is a network of Black males. I intentionally help to train Black males, but there is a network right here in Atlanta, phenomenal Black male therapists. So
Thank you. Last question. State your name and your question, please.
Hi, I'm Amber. Thanks for coming in and providing such great information. So once you recognize, like your process, the RAP process, once you recognize, acknowledge, and process, how do you start to, because I understand that there are different types of treatments or things that there's therapists, psychiatrists, psychologists, all of that. How do you start to, I guess, when it comes to moving forward to process it, what steps do you take to recognize which step, which
Which direction?
Yeah,
you
which
need
direction
see
to
what
go?
doctor
Like,
to
do you
call?
start
Yeah.
with a therapist and then they recommend you to a psychiatrist or a
Great
psychologist? Or
question. Let's
how
start
does
with
that
our
work?
psychiatrist, and then I'll have a therapist jump in. Dr. Broadwater.
Well, I think that assessing the severity. So like if there's a if somebody is suicidal or actively decompensated and you have a relationship with your primary care doctor, it probably will be fastest to get you in to see your primary care doctor the quickest. So that's the first thing. And looking at acuity, well, if they're suicidal, you can go to an emergency room to get assessed. I think it just depends. I would look at your insurance. Um, Psychiatrists provide therapy, psychologists provide therapy, psychotherapists provide therapy. So that would be the first thing is sort of looking at the different types of modalities. Some people, I think Shanti alluded to it first, that some people don't want to come see me because they think I'm like, I must be real crazy to go see you. So I'm not going to go see you first. I'm going to go to see somebody else. And then they say, everybody pushed me to you. So it just depends also on your comfort level.
Thank you. Anybody want to quickly add to that before we close out?
So is it basically just recognizing what your situation is, and then you kind of just go from the level and then kind of work
And
your way up?
you can also talk to your PCP, your
That's what I was gonna say
primary
first.
care physician.
Typically, that's who just because they're the gatekeeper and that's the doctor that you mention it to your healthcare provider. And a lot of times, and if you don't have one, believe it or not, people always forget that wherever county you live in, if you don't have you don't have access to medical insurance, you don't have it currently, you can go to your health department and there are
Community
clinics that are
service
right
board.
there.
Yes.
So you can use that as a source. And for people, so don't use lack of insurance as a barrier because that's what county health departments are for. And they are excellent. And you can use them as your primary care provider. If you're here in Atlanta in particular, and you live in Atlanta, Fulton County, you can go to Grady, and you can get what's called a Grady card. What they do is on a Grady card, they have clinics, they have hospitals, of course, and on a sliding scale, you pretty much will go in for treatment, right? So your copay for any appointments could be just $20. And so that would be your insurance. There's a network that exists. Kaiser's kind of the same way on a bigger scale, but that's like your county health department and your county health insurance. So yeah.
So
And you
I've
went-
actually mentioned that twice to primary care physician, and each time they've tried to prescribe like antidepressants without even necessarily even bothering to have a second conversation. Like I've literally had someone.
Let's talk
let's
after.
talk right
CB
after
after, okay?
Yeah, come
I'll
on
talk
up
you
to
through.
the front.
Okay,
Absolutely.
all right.
All right, you wanted to mention something?
There's something called the Georgia Crisis and Access Line. It's not just if you're in crisis, but it's a statewide referral number that can look at where you live, what your insurance is, and tell you who can provide you with mental health services. It's 1-800-715-4225.
All right, you all have been tuned into okay, let's say it one more time. Okay, pull it up. It is 1-800-715-4225. And also remember, you can just dial 988, just like you dial a 911 if anyone is in crisis. So you all, go ahead.
Really quickly, Brianna, raise your hand. So Brianna is my, Brianna, thank you, professional relations person, and that's her job, to connect. Anyone could call her and say, this is a problem, and she is going to connect you with the resource. She covers the state. I have another one out there at the table. His name is Philip. So if you are in that situation, get Brianna's number, and she will connect you with any resource throughout the state of Georgia.
Yes, see Brianna afterwards, and you can talk to the ladies after the panel. We also have some resource cards. Silence the Shame has resource cards at the Black Health Matters panel. You've been tuned in to Breaking the Stigma. Dr. Sarah Vinson, Dr. Sherri Broadwater, Dr. Sharnell Myles, Dr. Contessa Metcalfe. Give it up, and I'm your moderator, Shanti Das. Thank you so much for tuning in today. Make sure you take time, save a life, and silence the shame.
One more phone number, 1-800-662-HELP. That's the National SAMHSA helpline, 1-800-662-HELP. No matter where you are in the country, you can call that number. 1-800-662-HELP.